Bismillahirrahmanirrahim. Today we will have case quiz number 126. Case data: 62 years old female. The patient complained of pain behind her right heel for a day. Only 1 day history of complaint. Pain behind right heel. The pain is worse with activity and partially relieved by rest. The patient had no fever, no back pain, no swelling, no skin rash. The patient eats a healthy diet and walks 2 miles every morning. So she lives a healthy lifestyle. The patient has no chronic medical problems. The patient was diagnosed with a urinary tract infection 4 days ago and had been taking ciprofloxacin. Her 55 years old brother had gout. Vital signs were within normal limit. Examination showed tenderness 3 cm above the posterior calcaneus with no leg swelling. So, what is the diagnosis? The answer is yes, it is easy, but not so easy. It is secondary Achilles tendinopathy, not primary. Secondary Achilles tendinopathy, secondary to fluoroquinolone use. Discussion of the diagnosis. This patient's presentation suggests Achilles tendinopathy, likely due to recent fluoroquinolone use. Continued use of this medication can lead to rupture of the tendon. Risk factors include age over 60, female sex, normal body mass index, concurrent oral corticosteroid use, and history of organ transplantation. Tendinopathy most commonly involves the Achilles tendon but can also occur in the rotator cuff, hand, biceps, thumb, and other tendon sites. Pain and tenderness is present 2 to 6 cm above the posterior calcaneus in Achilles tendinopathy. Drug manufacturers are required to include a boxed warning notifying the patient of increased risk of tendinopathy and tendon rupture associated with fluoroquinolone. Patients should stop the drug at the onset of symptoms, avoid exercise and/or use of the affected area, and seek medical care for symptom evaluation and changing to a non-fluoroquinolone antibiotics. So what about the key messages of this case? Fluoroquinolone use is associated with tendinopathy and tendon rupture, with Achilles tendon most commonly affected. Patients can develop tendon pain within 24 hours with a median of 8 days after starting the drug. Patients should stop the drug at the onset of symptoms, avoid exercise and/or use of affected area, and seek medical care for symptom evaluation and changing to a non-fluoroquinolone antibiotic. And finally, thank you very much for your attendance, and we will meet you tomorrow with case quiz number 127. Wassalamu alaikum wa rahmatullahi wa barakatuh.